Good morning, everyone. I hope you're all having a great time so far at the Philly Forward Real Estate as a Portal to Change. My name is Feona Castro, Managing Director at 17 Asset Management, and I'm also joined today by our Chief Executive Officer at 17 AM, John Morris, and our Director of Research, Jaishree Singh. In the next 30 minutes, we'd like to walk you through 17 AM's journey in Philadelphia and to give you some background on how 17 AM arrived together with the collective and to present our stakeholder driven and research driven journey that has led us to where we are at today. And with that, I'd like to turn it over to John, who'll share with you the background of where and how we got started in Philly. John, take it away.
Sure. If you change the slide, that'd be great.
Next slide, please.
Well, I will wait for the slides to catch up. But we came into Philadelphia after doing a good amount of desktop research to recognize the opportunity that Philadelphia represented for investors. We did not know what that investment would be. We approach any of the markets that we've been in, starting with when the company started, Jordan in the Middle East, and then last year when we initiated the Caribbean market and also Philadelphia. We approach markets first from a place-based focus, how to make change with a place-based focus. We then add to that collaborative design and how we can identify the right stakeholders to have an open dialogue and a non-siloed dialogue to create collaboration in the discussion of design, which is informed by a scientific and interactive research approach. The convenings that we have done have not been to have events or to create sponsorships or ticket dollars. They have been convening to gather stakeholders, to interview and to get insight on to what then comes next, to scale capital. Scaling capital requires design, prototyping, and outreach and capital mobilization. So that's our fourth stage. So the journey, particularly with within Philadelphia, after the research, and I'm going to pause. Fiona, do you know if we are getting? Have you made contact with Ramsey on the slide?
Yes, it is being presented.
Oh, I'm not seeing. Is it on? Maybe I'm not seeing it. Okay.
Yes, we see it, John.
Oh, you do. Oh, good. Okay. So the first stage in Philadelphia was when we launched the New Normal Initiative. We had the partnership with Impact PHL that we've had a history of working with, and gathered over 1,000 people for a 2-day discussion, asking leaders in the community across government, across corporates, across financial institutions, across community activists and nonprofits to carry on a discussion around 4 topics. Those 4 topics were inclusive communities as one, neighborhood essentials as a second overall topic. And the third overall topic was city infrastructure. And the fourth overall topic was collaborative capital. Those four discussions led a depth of feedback that then led to design sessions in which we had over 7 or 8 design sessions with 10 to 12 leaders to dig into those, which drove to our first output of research. And with that, I'll pass it to you, Fiona.
Thanks, John. A core pillar to our place-based approach to transformational change is our research. And since the beginning of 2020, we have dived deeply into understanding Philadelphia, as John has shared, starting off with initial scoping, but paired with a bottom-up, empathy-driven stakeholder approach to understanding what the key challenges are and what the key growth opportunities are in Philly. And as John has shared through the Philly New Normal Forum that we convened in May of last year, we engaged in dialogue with over 1,000 stakeholders representing various sectors in Philly, from institutional investors to nonprofit to corporate or private sector players to philanthropy, the government, and academia. A few months later, we dug deeper into these findings through facilitating roundtable sessions with 60 industry and thought leaders in Philly. And next slide, our findings from the first 2 stages of research are reflected in our first Philly-based report, The Case for Intentional Investment in Philadelphia, Part 1. And we found Philadelphia to be a highly investable city where intentional and collaborative capital mobilization is key. Next slide. So through these stakeholder discussions, we've identified recurring themes and a total of 140 on-the-ground challenges in Philly, including inequity across neighborhoods, income disparity, lack of access to resources, and especially lack of equity capital for entrepreneurs, the digital divide, the need for inclusivity, the need for healthy environments and safe spaces, among others. On the other hand, we've also identified growth opportunities that are specific to Philadelphia, recognizing the initiatives that local and national organizations have championed, including opportunities to empower small businesses, opportunities to bridge the racial equity gap, opportunities to bridge the gender equity gap, opportunities to create a more localized and diversified value chain, and opportunities to achieve equitable access to Philadelphia's essential services. And in mapping these challenges and opportunities to each other and to the United Nations Sustainable Development Goals, we found material with at least 10 SDGs, including SDG 10, Reduced Inequalities, SDG 11, Sustainable Cities and Communities, SDG 8, Decent Work and Economic Growth, and SDG 3, Good Health and Well-being. Next slide. Ultimately, we brought these down to some of the most transformational growth opportunities where we believe investments would be the most effective and catalytic, including real estate, healthcare, and the entrepreneurship ecosystem. And at the beginning of this year, we have published follow-on reports that focus on these growth opportunities, particularly in healthcare and in real estate. And to provide you with highlights of these reports, I turn you over to Jaishree Singh.
Thanks so much, Fiona. Ramsey, next slide, please. Yeah, so as Fiona mentioned, this year we published a few reports that dug deeper into a couple of these issues, namely real estate and healthcare. Next slide, please. Let's go forward. Yeah, there we go. So we researched how investors could mobilize capital to enable social equity and close racial wealth gaps through strategic investments in healthcare and real estate. Let's start with healthcare. In March 2021 and February, we examined the disconnect between the fact that Philly is home to world-renowned healthcare institutions. We know UPenn, we know about CHOP, but it's also home to widespread poverty and ill health, particularly among people of color. Why is this the case? So we explored this further using a city-based health model and place-based model to explore how investors could leverage capital in order to influence the social determinants of health. And for those of you who aren't familiar with that term, it's often used in public health to refer to where we live, where we work, the air that we breathe, and what we eat. Interestingly, traditional healthcare systems only account for 20% of health outcomes, whereas the social determinants of health account for 80%. So what does this have to do with real estate? Well, the majority of Americans live in cities, and rapid urbanization is actually associated with ill health. You can probably picture it. A very dense city is accompanied with lots of poverty, lots of slums, and cities experiencing the fastest growth will see the greatest uptick in slums and poverty. And I mentioned the social determinants of health includes where we live and where we work. So this includes, say, our houses, our apartments, our row homes, our neighborhoods, and our cities. Next slide, please. So our next paper discussed real estate. We realized that real estate is very complex, as this forum has described it. Cities like Philadelphia are not designed around people, as they should be. Cities are not seen as living organisms that require vital resources and infrastructure and interventions, but they should be. They are dynamic and they are like living things. Scientists all believe this, and we believe that investors should see it this way. We think that developers and investors could take a more science-based approach to working together and really design spaces around people. We wanted to help bridge the divide between real estate investors and healthy urbanism, which is a science. So this month we began a series focused on real estate, which is a 3-part series focused on the power of housing in improving 1, public health, 2, economic development, and 3, environmental justice. The first paper focused on public health. So we've been discussing on and off the power of metrics and outcomes. So let's talk about that. What does the science say? There are maybe 4 key pillars that are the relationship between real estate and health: cost, condition, consistency, and context. So let's talk about what they each mean. Cost refers to affordability. The gap between housing prices and income levels for Black and Brown communities has widened over time due to the racial wealth gap and gentrification and exclusionary zoning. Condition refers to the internal state of affairs within a home. You can probably picture a very dilapidated building. We talked about blight earlier in this forum. You know, does a house have things like thermal insulation, protections from storms and fires? Is it energy efficient? Is it structurally safe? Are all the floors even? Does it have proper protections around the windows? And are the pipes free from lead? These are all important for health, and you can probably picture why. Consistency refers to the ability for a person or a family to remain in the same home for a long period of time. This is actually quite important. For a child wants to feel like they're in the same place for a long time because it's important for their sense of stability. Also, an adult has a better time finding a job and keeping a job when they're in one place. Context refers to the quality of the neighborhood. Let's bring back the idea of blight, a very old, dilapidated building, or a series of that. Picture your whole city just filled with gray, brown buildings that don't look very beautiful. And it actually causes more anxiety in people. It encourages people to commit firearm-related crimes and violence. It discourages people from venturing outside their home and accessing goods and services, participating in physical activity. But instead we create an environment that's peaceful and encourages community connectivity. So during COVID, we learned that the lack of a consistent home without clean water to wash one's hands weighed quite heavily. Living in overcrowded homes increased the likelihood of spreading disease. So I've talked a lot about the science. Too many vulnerable people suffer from the lack of healthy housing, which exacerbates physical and mental health. If you breathe in only dirty air from your house or from outside your home, it affects your lungs. If you drink dirty water from, say, pipes that leach metal into the water, it affects brain development. That's very serious in children. Also, the stress from not meeting your housing payments and from moving from home to home causes compounded stress. That's actually quite important in a public health sense. So we studied all of these things, and we believe that healthy housing and healthy urbanism shouldn't be a luxury, but a right. And we are so excited about the collective because they're helping make this happen. Next slide, please. So what if we disrupted traditional approaches to real estate investing? Investors can invest in instead affordable housing that adhere to an elevated set of public health and environmental codes. They incorporate things that we may not have thought of before, but scientists have: acoustic comfort, lighting, thermal comfort, sanitation, biodiversity. These things are all super important. We see why now. It's not just physical, but it's mental as well, and important to children. So in this first paper, we talked about the Collective Investment Fund. We found them to be a very compelling group with the background and experience to actually build racial equity through strategic real estate investments, using evidence-based diligence. This is a new way. It's actually, as we've talked about and as you've heard, this modality of investing is actually not so obvious. It's not mainstream yet. But we want to make it so, and that's why we're so excited about the Collective, because they're using this approach in their diligence process. So in this research series, we talked about public health, and in subsequent papers, we'll talk about economic development and environmental impact and justice. So again, we're going to be incorporating lessons from the Collective, and we're going to be talking about the science behind healthy housing and healthy urbanism, not just because the academics have been talking about it for years, but because it will help enable better investments. This is the point. This is what we really want to drive home. Next slide, please. Yeah, now I want to pass it back to my colleague Fiona to talk about IMM.
Thanks, Jaishree. So the way in which we look to support the Collective is through working together to develop a robust impact measurement and management framework that will uphold best practices, but will also serve as a pioneer in setting the right standards and the accurate nomenclature to truly measure and uphold racial equity outcomes. We feel any investment of this type requires high-quality IMM integration, or impact measurement and management integration, into the investment cycle. And we've been working with the Collective to go through all the appropriate measurement criteria along stages of investment, from origination to evaluation to closing, post-investment, and exit. Next slide, please. We use what we call a dual lens approach in IMM, where we utilize both best-in-class ESG frameworks such as SASB and the Global Reporting Initiative as a risk assessment tool, and the United Nations Sustainable Development Goals and other leading impact investing frameworks to measure, on the other hand, the intentionality and additionality of each investment. And in utilizing these internationally recognized frameworks, along with in-house metrics, data-driven in-house metrics that we are developing with the Collective, we seek to measure outcomes across 4 key areas: racial equity, diversity and inclusion, affordable housing, holistic neighborhood development, and economic opportunity and wealth generation. Next slide. So we hope that through sharing this background and our journey at 17 Asset Management, we are able to share how our research-driven and stakeholder-driven process has led us to areas that can drive a more sustainable and inclusive growth for Philly, and how this enabled us to identify the major opportunities for such a transformation. I'll pass it back over to John to tell us why the Collective is critical to achieving this transformational change.
Thank you. But I'll pause on that because the founders of the Collective are joining. But I will just add a few comments to Jaishree and to Fiona's comments in the data that they are putting together, and we're supporting the Collective with. This work in collaborating with the Collective goes to the next level of collaborating with the developers. And we're so excited about their vision and their commitment to those social determinants of health in those metrics and desire to be leaders in this space. I think the city of Philadelphia also has Philadelphia is a perfect city to be pioneering this because of the deep commitment Philadelphia has made to data mapping and its own open Philly data efforts that I think in time, the collective can be a great example with measurement coming from the collective network and being implemented through the collective investment group. And then lastly, organizations like TRF and their policy map in some of the mapping initiatives through the effort of collaboration. We hope to bring as many partners in this process as we can. But all of that data, all of that research, all of the measurement has no meaning if you don't have something to measure. If you don't have leaders that are willing to bring together an effort such as the collective.